welcome to Healthy Talks. We're here with another episode. My name is Julie, and today we're with Kathryn Nieuwstadt, who is a physiotherapist at Netcare Private Hospital. Hi, Kathryn. Thank you so much for joining us. How are you doing today?
I'm great. How are you doing?
I'm good, thank you. So let's jump in. What inspired you to pursue a career in physiotherapy?
Um, Honestly, when I was in high school, I really enjoyed biology and I learned learning about how the human body works, and it just kind of piqued my interest then. Um, but actually, what the pivotal point was when I injured my knee during hockey the one time, and I had to go to the doctors. And I was sitting there with my mom, and this doctor was explaining what is going on with my knee. And he was explaining things like saying patella instead of kneecap and
Hmm.
bursitis and all these things. And I sat there and I was like, I understand what he's saying. This is fascinating. And I looked at my mom, and she had the most confused look on her face. So I was like, wow, this is quite interesting. And then yeah, for my rehab, I started just researching things, and then I came across physiotherapy, which I'd never heard of before. So, and since then, I just loved it.
And you mentioned before that you did your community service here in Port Shepstone. Describe your experience there and what were some of the key lessons that you learned during your time?
Well, I actually worked at Port Shepstone Regional Hospital, so it's a very large hospital. So I got a nice experience with all different fields, so orthopedics, pediatrics, medical, surgical. I even got to do some community work as well. I went to different clinics in every
Hmm.
month, like 6 different clinics. So it was really nice just, working with the locals and getting to know them as well. Um, so I think it, it sparked me wanting to be in the hospital field so I can get a bit of everything, rehab and yeah, it was just working with multidisciplinary teams, which is working
Mm.
with other allied health, like occupational therapists, audiologists, speech therapists, working with the doctors, the nurses. It's just it's great to see a whole team come together and just see how you can help one person's lives. And
Mm.
even though they don't always thank you, you know that at the end of the day, you help that person.
That's amazing. And as someone that is passionate about rehabilitation and musculoskeletal disorders, what are the most common challenges you face in treating injuries?
I'll be honest, one of the most difficult things is when someone comes to me and asks me for help, but then also doesn't listen to me. Like I tell them do exercise and then they won't do the exercise. And yeah, I think, but a lot of it comes down to psychological things.
Mm.
People don't always understand because they don't understand how their body works. So they just kind of take it for granted. So when it comes to fixing the body, a lot of the time it's to do with movement. And now you think movement causes pain, so why should I do that? But then actually in the weird concept, movement actually gets rid of pain.
Mm.
So it's trying to educate my patients to understand their body a bit better and understand why I'm telling them to do what they do. So I sort of feel like a teacher, a psychologist, a physio, just
All in one.
you have to teach them a bit of everything. You have to speak to them on a level that they understand as well, which yeah, I think that's what really my patients really enjoy about me is that I speak to them as a person and not
Mm.
just a number or a person in the bed.
And what would you say to someone who keeps coming back to you over and with the same injury who hasn't listened to you? Is there any like communication techniques that you would use?
Um, I just try and then understand them a bit better. So I just ask them about their life and what they want out of themselves. I ask them what they want, why are they coming to me, and if it's not getting better, because there is times, like you said, people don't listen to me and don't do what I say. Um, And it does get quite difficult, and that's usually when I involve someone else. So I might send them to another person, another professional, to see if they can maybe get through to them in some way or do something slightly different that I'm not doing. Um, but yeah, I don't really get that often, thankfully enough.
And working at a private hospital, what are some of the differences that you have noticed in patient care compared to your experience in public health setting when you were doing your community service in Port Shepstone?
So I find that patients are a lot more appreciative in government settings, which I find quite funny, because they're not really paying for it. But and you're working with people that you don't know. So like when I
Mm,
was in Port Shepstone, I was working with Zulus, and I don't speak Zulu, so there was always that language barrier there. But there's ways that you can just show them what to do, and you see their appreciation in their eyes. Like the ones that broke their leg and then they couldn't walk, and you teach them to walk in a few days, and it's
mm,
just their face just lights up and their family lights up. um and with private healthcare, it's great. Some people are very appreciative, but you also get those that are not so, and they
mm.
come to you as well, and they like, help me, and then you say, okay, this is how I can help you. No, 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 I don't want to do that, like, give me something else. They yeah, they can be a bit more difficult, but yeah, I still find most of them are great. And what I like about both of them is, with private, you have a lot more resources, so you
Mm,
can do a lot more things. You got a lot more equipment to work with as well. Whereas with government, you have to kind of think outside the box of how to help your patient. Um, and yeah, I enjoy both challenges, learning how to use new equipment that,
yes.
we never really got taught in university or never experienced during my university career. Um, Compared to, how am I supposed to get this person breathing better? Do I have to make up a little device for them to do breathing exercises? Whereas in private healthcare, you can just buy one with
Yeah.
those balls that you blow up and down. So both of them are great.
That's good. And you were saying that there was a language barrier when you were doing your community service with the not being able to speak Zulu, and you've also worked in various different departments of hospitals. So how do you approach working with a diverse range of patients from medical and surgical cases straight through to pediatric and ICU patients?
Um, well, language barrier is still a thing because I only know English. So Afrikaans, when there's Afrikaans people, it does get a little bit more difficult. But a lot of the time I can show you what I need you to do. So we can still communicate that way. Um, but in terms of different patients in different departments, you kind of just have to take them as it is. You have to see what's going on around them, like chat to the family, chat to get their history, and see what kind of person they were
Mm,
before they came to the hospital. You know, um, it's just everyone's so different, and I think that's what makes me enjoy it more. As there's always a new challenge. There's always
mm,
something new that you have to figure out. A new condition that you've never experienced before, and you just have to think on the spot and say, okay, well, let's fix this person. And then you figure out something, and then it works, and then you just remember it. And then, I know what to do next time. So, but ICU is very scary. I'm not going to lie.
yes.
All those pipes and things beeping, and yeah, it does make me nervous, but I'm getting more comfortable the longer I'm there.
Now I can
It's
imagine walking
quite
in there
fun.
and just seeing all of those wires and pipes. It's not an inviting
Yeah,
environment.
yeah. Like I see the other side of it, but it's still nerve-wracking, because anything can
Mm.
happen at any point. Well, with any patient in any department can
And
happen.
talking about patients and having those experiences, can you share a particularly memorable patient recovery story that reaffirmed your clearly passion that you have for physiotherapy?
So I was actually thinking about this patient the other day, and the best part about it is the fact that he was Afrikaans, but he spoke like high-end Afrikaans that not even the social worker who is Afrikaans really could understand what he was saying. Like, I don't know, there's a different type of language
Yes.
as well that I don't know. And so we could not communicate. It was literally just by showing hands and doing things and us me speaking English and him speaking his language. And but so he had COVID and he was in ICU for a very long time to the point. So when you're on a ventilator and everything, you're not moving your limbs, so your muscles atrophy, they get weak.
Mm.
So he got to that point where he like couldn't even lift his head when he came out. Like the most he could do was breathe. And it was just amazing working with him for those few months of watching him not being able to move a finger to being able to sit up on the side of the bed by himself and start lifting his arms and start lifting his feet. And I think
Wow.
we did manage to get him standing a couple of the times. It was quite difficult, but he persevered. And we also did. We fought with him. We fought with the medical aides because they didn't want to pay for longer, and we managed to keep him an extra week at rehab. And then actually a few months later, I got a photo and a video from the social worker who went to go check in on him. And he was walking around with a walker and wheeling himself in a wheelchair. And it was amazing because his life, he had no life. And then
Mm.
I got to work with him, well, me and everyone else got to work with him and we gave him his life back. And, I hope he's doing really well.
Yeah, it must be amazing feeling like after all that time, and then you see it like months later, you've gone on with your life, but it's in his head, like you and your team was still part of him, rehabilitating
Yeah.
him, giving him a life back. That must be
Yeah.
amazing feeling.
Yeah, no, it is great. Sometimes we even get like emails or messages from our patients just saying thank you for this. I'm feeling so much better. And it really warms my heart.
Enjoying this episode? Ever thought of starting your own podcast? Podup.com is your go to. They've got everything you need to run a pro show, including 35 or more AI powered tools for success. Sign up today for a free starter account and get 15% off with the code HealthyTalks15. The code is HealthyTalks15. Plus, check out podallies.com for a done for you podcasting experience, complete with website, social media, and editing. Start now and let's launch your podcast together.
That's great. That's beautiful. And tell me, how do you tailor your rehabilitation programs to meet the individual needs of your patients? Say, like you get to know them, their background, their family. You try and show them how to move if you can't speak the language. But are there any other skills that you use to help them?
um, not particularly, not that I can think, nothing major. It's just treating them holistically, treating them every part. Like I said, there's a lot of psychological aspects to
Mm,
physical movement that you don't think about. We take our body for granted a lot of the time, and when you land up in hospital and something's happened to you, you can't do something anymore. It really works on your mental side of things. So it's just constantly just cheering them on and reminding them how much better they're doing today compared to yesterday. And
mm,
just yeah, it can get quite difficult, can get quite emotional for myself as well. I've cried many times over patients when they just like they start giving up, and
mm,
I refuse to give up on them. So yeah, it's just but getting their history is the
mm.
main thing, and finding out what it is that they do with their life and what they want to do with their life and where they want to get back to. And then I just make that a goal. That is because that is you when you go to hospital, you want to come out better than before.
Yes.
So, and lying in a bed for a few days, you don't realize how much that actually affects your strength. And
Mm.
you know that's a lot.
How do you deal with your own mental health when it comes to patients like that and struggling, and you are their pillar, so you're trying not to give up on them, but how do you deal with yourself? Because yours is just as important as theirs.
Yeah, it's definitely something that I've dealt with for a long time. And I've well, funny since I came back from my ComServe year, things weren't so great there. But when I came back, I started actually going to therapy myself and realized that a lot of, my passion when it comes to
Mm,
physio and dealing with their traumas and having to be the stronger person all the time. Yeah, I definitely needed to go seek help myself, and I still do to this day. It has gotten a lot better. I have dealt with these emotions and I can manage them a lot better. I can
mm,
hold on to them for like a day and then I pick myself up and move on instead of holding on to them for
yes.
weeks at a time. Those were rough. But there's a certain few patients that just really strike your heart chords and
Yeah.
they get through to you. But the other ones you gotta look at the positive,
Mm,
they're in their worst state, some people are extremely scared. So you just gotta be the
yeah.
bigger person and keep them going.
No, that's
Yeah,
true.
that keeps me going as well.
No, that's very true. If you're going, you're there, you can push them to go.
Yeah, because watching them
And
get better makes me feel
yeah,
good.
no, definitely, definitely. And talking about just like the physiotherapy industry as a whole, how do you stay up to date with the latest developments and techniques in physiotherapy?
So, with medical degrees in this country, you have to do a thing called CPD, which is continuous personal development.
Hmm.
So, you constantly have to be learning something new. You have to get 30 points a year, I think it is. Um, and you can do that via courses or doing articles online or online courses. Like I've done dry needling course before, and I've done strapping course. I've done high velocity thrust course, which is basically what chiropractors do.
Hmm.
They snap you like a glow stick. Great. Um, yeah, and it's just, sports injury courses. You can learn about fascia release. Yeah, there's so many different courses, and it's just amazing because you get all these lecturers that come from all over the world that
Mm,
come to do these things. And you see them quite famous on the internet, and then they get to come here, and you're like, oh, wow, like you're really great at your job. And I personally prefer doing courses because I learn better in
mm,
practical settings than just like reading a textbook or reading an article. But they're quite expensive. I'm
yeah.
not gonna lie. It's a bit difficult. It can cost you like 1,000 rand and then only get you like 3 points.
Oh, wow.
So yeah, sometimes it can be quite rough. And then there's other courses that can take you 6 months to do, which cost you like 30,000 rand. And it costs you a lot of money to be a medical professional in this country. You know.
What was your favorite course that you've done so far?
I would say dry needling. I learned about it when I was in university still, and you can only do it in your ComServe year. Like you have to be fully qualified because obviously you're stabbing someone with a needle, so you
Yeah.
need to really know your anatomy and know that
Mm,
you're not putting it in the wrong place where you could actually hurt someone. Um, and yeah, since then, the first place that I worked for a private practice in Pinelands after my ComServe year, and I learned a lot from her about needles as well. That's where I got my most experience, and yeah, I've just excelled, and I've just kind of tried different things. I
mm.
find my friends and I practice on them, and I had my one friend that was pregnant, and she had her jaw was hurting. So I practiced needling in her jaw to help her because she couldn't take medication, and it worked. And now
Oh,
I know how to do it.
that's great.
So yeah,
I
it's
must warn your friends.
yeah, she is still thankful to this day. I fixed her shoulder pain that she had for like 3 years in like one session, which I had
Sure.
no idea. I was looking at the book trying to figure out where to go and try and where do I put it in. it
It
worked.
worked.
And that's kind of how you have to learn in life. You just got to try something, and if it works, it works. If it doesn't, it doesn't. Try something else.
No, that's
Yeah,
true.
that's kinda same thing with physio. You gotta. That's why it's different with everyone. Some people are very textbook standard, and other people
Mm,
you really have to try outside the box and think of a completely different way of helping them out.
no,
So
that's
always a
true.
challenge.
And what role do you believe physiotherapy plays in the broader healthcare system, and how do you advocate for its importance?
Well, obviously, I think we're on top. No, I'm joking. Um, we have this love-hate relationship with doctors. They love to just prescribe medication and try and get rid of pain by masking it, whereas
Mm.
we like to fix the problem. Yes, might be moaning and crying throughout this process, but you will be feeling better, and I promise you. Um, so it's just, trying to also teaching doctors that, it is okay that you can send, if you don't know how to fix
Mm,
someone, maybe send them to a physio. We're fortunate in this country that we are actually first line practitioners, which mean that you can come to us first before going to a doctor. You don't need a doctor's referral to
yes.
see a physio, which can save you a lot of money and a lot of time, because a lot of people don't like taking pills.
Mm,
So it's better to come to us. So, and just, doctors give you a life, but I feel like we give you back, like doctors save you, but we give you a life. A doctor will fix mend your body, but if it weren't for us going to you every day and forcing you to get out of that bed and forcing you to cough out all that phlegm in your lungs,
mm.
like you're not going to be able to get up and do your life again. So yeah, it's great to watch people go from the worst place to the best place and just live. Watching them walk out the hospital, that's something amazing.
No, that's great. Very much for joining us today. I really do appreciate your time, taking time out of your busy schedule, and I hope that our listeners have also now more better understanding of physiotherapy. It's definitely certain things that I've learned about your career. So thank you very, very much for joining us today.
You're very welcome. I'm glad I could help in any way.
And for all our listeners out there, remember to like and subscribe, and we'll see you on the next episode of Healthy Talks.